My name is Linda Moore. I'm a midwife in the CUMH, part of Ireland's South Women and Infant Directorate. I am in room 9 in the CUMH, and so this is a room that we have put attention into making it as nice as possible for somebody who comes in labour. There's a beautiful scene on the wall. The room can be changed to whatever way you want to, and there's lots of equipment that's available to you whenever you come in labour. So that's why I'm doing the class in this room. This is about normal birth and normal birth preparation. So first I'm going to look at antenatal preparation. So when you're pregnant, what should you be doing to keep yourself as well as possible and to make this as good an experience as possible and for your outcomes to be as good as possible? And that's what this session, first session, is all about. I think that there are areas that every woman needs to do. So the first one is exercise. We need to be active. Our bodies need to be fit. We need to be putting exercise into them. Part of this exercise is about getting the baby in as good a position as possible for birth and labour. So we call this optimal fetal positioning, and this is all about being as upright as possible and the baby being as forward as possible. So I'm just going to show you what I mean with my baby. Pretend baby. This doll is a term looking baby, and so if I was pregnant with it, really the ideal is that we're trying to get this baby with its back forward, so on one side of you or on the other side. It can be either, or it can be fully frontal, okay, which is good too. And this makes it much easier for you to go into labour and birth, and the birth is much better, rather than being behind with the back lying on your back. So that's what optimal fetal positioning is about. It's trying to get this baby to be in as forward a position as possible, and obviously with its head down and its back in one side or another. And for this you will know that the baby's on one side or another because of the baby's kicks. Baby's legs are kicking on one side, and hands, it's a tickly movement on the other. So the feet and knees are giving you a much more vigorous movement, and the hands are a tickly movement. And this is optimal fetal positioning, and it's about being as forward as possible, which is why we have balls. For optimal fetal positioning, one of the things that we recommend that you get is a ball, a birthing ball or a gym ball. Very easy to buy, very easy to get. So find one that fits you, and there's lots of that being shown, and so you can find out more about it. This ball fits me, and it's comfortable for me. My thighs are parallel to the floor, and whenever I'm sitting on it, my sitting bones are sitting under me and my back feels normal and right. And this means that this baby is going to be in a good forward position. You're not sloped backwards, you're not sleeping, you're not slouched in any way. So therefore, the weight of the baby is more forward. The back is more forward whenever you're sitting on a ball. Our recommendation is that you would be using the ball every day, really, whenever you're sitting down. So before 36 weeks, maybe watching television on it afterwards, or whenever you've had your meal, and rolling on it or bouncing on it if you feel like it. But from 36 weeks onwards, we really recommend that you should be using this maybe 2 hours morning, 2 hours evening. And look at the exercises that you can do. So if you can imagine that if you're sitting in a ball, your baby is in this forward position and is comfortable, and you feel comfortable. It's better for your hips, your spine, your alignment, and everything for you yourself staying healthy, which is why we recommend the ball. Now, there are other exercises that we also recommend for you. We would like you to be using, to be as active as possible. So you could be walking, swimming, doing lots of different exercises like yoga, Pilates, any other exercises. All are good for your spine and for you staying mobile and active. So having a mat of some sort under your knees, or a pillow under your knees at home, but something under your knees at home, because you could be doing quite a lot of work on your knees, rolling the ball forwards. And this is all about getting your body in tune, or you being in tune with your body and you becoming aware of it and being comfortable and confident in yourself, so that you believe in your birth and know that you can do this.